Dr. Christina Chester, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges that we are faced with today. So for our viewers, you may notice that my name has changed, and now I'm Dr. Chester instead of Dr. Connolly, just because I recently got married. So I'm very excited about all of that. And as we're going through today, let's just keep going. So we have a great show with you. So first, I have with me today Ms. Makeyda Soriano, resource counselor from Montgomery Blair High School. Thank you for joining us today.
Thank you so much for having me today, Dr. Chester.
All right, so today we are discussing how eating disorders impact students. So for our first question, can you share with our audience, so what are eating disorders and what types of eating disorders impact students in our schools?
Of course, an eating disorder is a psychiatric condition in which there is a persistent disturbance of eating or eating-related behaviors that often results in medical, psychological, and social impairment. The most common eating disorders that impact our schools are binge eating disorder, bulimia nervosa, anorexia nervosa, and other specified feeding or eating disorder.
Oh, thank you. And so then my next question is, so what are some of the symptoms of having an eating disorder? And what are some of the things that students, families, and staff should be aware of, just in case like they may have a student who has an eating disorder?
Yeah, well, eating disorders are serious, complex conditions that include a pattern of eating behaviors negatively impacting an individual's health, emotions, and ability to function across settings. It's important to recognize the early warning signs and symptoms that can include fluctuations in weight, obsessing over food, calories, body size and shape, and exercise, developing and adhering rigidly to specific food or exercise rules, routines, and rituals, disappearing after meals, eliminating foods or decreasing food variety, hiding or hoarding food, eating in secret or isolation, eating more or less than usual or at a slower or faster pace. Also, it can include engaging in a lot of baking or cooking, generally to be enjoyed by others, isolating, withdrawing from friends and activities, menstrual irregularities, other psychological or physiological signs, including cold hands, swollen feet, dehydration, dry skin, hair, discoloration of teeth or cavities, impaired immune function, swelling around salivary glands, difficulty concentrating, fainting, GI complaints, and sleep disturbances. Students, families, and staff concerned that a student may have an eating disorder should trust their instincts, as they may be more aware that this is a problem than the individual or that they are willing to admit. It is helpful to reach out to a trusted adult if you are a student concerned, and to consult with professionals like school counselors, school psychologists, or pediatricians if you are a family member or staff member concerned for any recommendations and insight.
No, thank you. And I know, and especially for our families who are listening in, who may be wondering if, maybe their child has an eating disorder. When we think of like GI or gastrointestinal concerns, you might have a kid who has a stomach ache. From what you're saying, these are much more, involved, especially if they're like purging or throwing up their food a lot, like they go and hide after they eat something, then all of a sudden they disappear to the bathroom every single time. That might be a symptom of something else is going on. Folks who have eating disorders have significant control concerns too. So, no, but thank you for all of those symptoms, because these are all things that, may just be like a stomach ache and you ate something bad, or if it's happening repeatedly and over time, it may be a cause, saying that there's something else happening. All right, so my next question is, what types of treatment supports students who do have eating disorders?
Yeah, well, many treatments require a multidisciplinary team. So that includes the pediatrician, a psychiatrist, therapist, family therapist, and dietitians working with the school. Many of these treatments can be at an outpatient level or within a higher level of care setting. A proper care team will be helpful in supporting and informing treatment decisions. So this team is going to be vital in letting you know the exact program that might be beneficial for your student. And it's important to remember that eating disorder recovery is possible. And with an evidence-based approach and an interdisciplinary treatment team, the better the outcome. So we really truly hope to work with our families and their students and ensuring that they have all of the supports that they need for recovery.
And oh my God, that is so critical to have, like you said, that multidisciplinary team where you have the family, the school, the outside providers like the pediatrician and nutritionists and others who specialize in working with those with eating disorders. I mean, we're lucky in Montgomery County that there are several clinics, you know, in some of the local hospitals that specialize in supporting students with eating disorders here in our community. So we just want to make sure that, you know, we are providing that comprehensive support. And of course, if a family has a student who has an eating disorder, you know, you can also talk to the school, and maybe you may need a 504 plan, or if it's impacting your education, you know, in terms of your grades and so forth, then maybe you might need an individual education plan or an IEP. But there are a lot of supports that schools can provide to help the community team and the family to support students with eating disorders. So thank you so much for that. And so my last question is, so do you have any suggestions or feedback for families and students to help them to stay resilient during this time?
Well, personally, I find spending time watching my favorite shows like the Chicago franchise. I mean, I watch Chicago Mad, Fire, PD, or listening to my favorite artists. I'm 100% in the Beehive. Allows me to regroup or settle as I work towards staying resilient, especially during difficult moments like what we've experienced with this pandemic.
Oh, no, thank you. And I am sure there are plenty of members that are with you that are part of the Beehive. I am a big Beyonce fan myself. So thank you for sharing. So, and I want to thank you, Makeyda, for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time for MCPS Waymaking.